topic in reproductive and sexual health nursing is newborn. I will explain what is immediate newborn care. Immediate newborn care is a care given to the neonate after delivery births by nurses or doctor in the delivery room. At the end of this topic, you can explain immediate newborn care and also explain assessment of baby using APGAR score. Immediate newborn care having 10 important steps, which is the first of all, we have to clearing the airway. We have to wipe the mucus gently from the mouth, gentle suction at low pressure by using soft catheter and also sucks the mouth and nostrils. After that, we have to prevent heat loss. Dry the baby immediately after birth, remove the wet towel, wipe the baby with a dry pre-warm towel, cover the baby head and also put under radiant warmer. And also we have to cut the cord. Cut the cord after clamping to prevent bleeding from the umbilical cord. For safety, we have to put identification to baby using bracelets. So, identification should consist mother's name and registered number, time of birth, sex of the baby, tying the name tag for the baby. The important part is assessment of baby condition, which is using APGAR score. What is APGAR score? It is a quick assessment of overall newborn well-being, and we use APGAR score at 1 minute and 5 minutes of life. Why is the APGAR score necessary? The first 1 minute APGAR score reveals importance about the baby's physical health in the first minute after the birth, helping the doctor decide if immediate or further medical treatment will be necessary. The 5 minutes APGAR score measures how the baby has responded to any resuscitations attempt. APGAR score consists 5 elements to score the baby, So which is we have heart rate, respiration, muscle tone, reflex response, and also color. For heart rate, we score 0 for no heart rate, 1 for heart rate below than 100, and 2 heart rate above than 100, which is baby show obviously vigorous. For respiration, 0 for not breathings, score 1 for weak cry, score 2 with strong cry. Muscle tone, 0 for limbs, score 1 for having some flexion of arm and leg, and also score 2 is active motion. For element number 4 is reflex response, which is 0 for no response to airways being sucked. Score 1 for grimace during suction. Score 2 for grimace and cough or sneeze during suction. For the last one, the element last one for APGAR score is color. 0 for the baby whole body is completely blue or pale. Score 1 for good color in body, which blue head or face. Score 2 is completely pink and good in color. All the APGAR score total scoring for score 7 until 10 is routine post-delivery care. But if scoring is 4 until 6 is some assist is required for breathing. If scoring below than 4 is life-saving measurement. So have to do. Next, the steps in immediate newborn care is promotion of parent-baby relationship. The important is bonding. Bonding to establish of parents and baby relationship in early neonatal period. After After that is vaccination. We give IM hepatitis B 2.5 microgram to prevent hepatitis B immediate post-delivery. Intradermal BCG 0.05 ml to prevent tuberculosis during 24 hours post-delivery. IM vitamin K 1 milligram as a prophylaxis against bleeding disorder. After that, we have to measuring the baby weight, baby length, and also head circumference. For baby weight, if the baby is born between 37 to 41 weeks of gestation, the weight is about 3.5 kilo. The baby length, usually the baby length is between 15 to until 52 centimeters. The head circumference, the baby head circumference normally between 34 until 35 centimeters. Next is blood investigation. Via cord bloods collected. The investigation is G6PD. G6PD is a glucose 6-phosphate dehydrogenase. It is the enzyme that we found in the cytoplasma of all cells in the body. We also test for TSH, thyroid stimulating hormone, blood grouping, and also the rhesus factor. The last one for immediate newborn care is prevention of infection, which is we have to wash hand before touching and after touching the baby, using equipment for the baby, and don't share with others. Reduce the number of people handling the babies. People with infection don't handle the babies, especially respiration problems. Cleaning the baby by giving regular bath. Cleaning the eyes if there is any discharge. And also we have to keep the umbilical cord clean. And additional, we have to prevent the injury for the baby. Baby should not be left unattended in a cot, and also don't use safety pin to secure the napkin. Okay, that's all. Thank you for your attention.